Yeah, hi Vinus. Very good morning, one and all. Hope you're doing great. So, this is Dr. Shree from INBDE CONQUER. Now, I'll be listing out the topics of general anatomy or anatomy and how you have to organize them to make your preparation easy and, of course, to make your revision more comfortable. So, logic for any competitive exam, particularly for a dental and a medical student, where you have your utmost focus towards the memory based aspects, handling so many subjects, because dental and medical we have so many subjects and we need to revise them because it's more of a memory based exam. So your organizing your stuff is more important, so that you will be more comfortable in the last 15 to 20 days to touch all the subjects, so that you can enter the examination hall with lots of confidence. So keeping this in mind, I have taken the basic reference of dental decks, okay, which most of you will go through for your national boards preparation. So I have taken the contents in that and I try to organize in a most customized way so that you can feel comfortable and proceed with the preparation. So among the topics of anatomy, so I have listed, okay, 7 topics. You can consider as 6 or 7 topics as must-do topics for your anatomy. So out of that must-do topics, the first one I want to stress on is osteology. So in osteology, it is mandatory that you need to complete. It includes joints, it includes the foramens of your skull and the contents which are going through the foramens, and it includes different bones in the body, all 206 bones. Okay, it includes all the bones, all the joints, and all the foramens. Okay, so that is the main thing that we need to focus on. So this is all about the osteology, which is one of the important things. And coming to the second topic, which is a common topic covered in many other subjects, like even in physiology and biochemistry also, we talk more about cells and cell organelles initially. Even in microbiology, pathology also, we'll talk about cell and cell organelles. Okay, so we talk about prokaryotic, eukaryotic cell differences and everything in almost all these subjects. Even in general histology also, which is not listed out in anatomy, in histology also we talk about cells first, cells and cell organelles and all these things. It's a very common 11th 12th standard 11th 12th grade topics which you have to do, but it's better you try to finish these topics in your anatomy itself. Then jumping into the nerves, you should be very familiar with the cranial nerves, all the cranial nerves, their branches. Particularly you should be very focused on the nerves which moves around the head and neck, which are very important, particularly from dental student point of view. As you are giving a dental oriented exam, it is mandatory that you should be clear cut and perfect with the 2 nerves. One is definitely the trigeminal nerve, and second one is your facial nerve. Then comes with the muscles, and muscles also utmost important is muscles of mastication, muscles of facial expression, and muscles of head and neck. Okay, your sternocleidomastoid and all these are very important aspects that you need to work on. Apart from that, there are few areas where they're asking questions throughout the body, but you should be very familiar with head and neck. Nerves and arteries of head and neck throughout the body. And coming to the embryology, the basics of embryology, you should be perfect with the basics of embryology. And coming to the lymph node histology, you should be perfect, as well as the levels of lymph node, because levels of lymph node are more integrated to your neck decisions, which we are going to learn in oral surgery. So it is more related to the application part of oral surgery. Or they can simply ask, this particular part of tongue is drained to which lymph node, or this particular salivary gland is drained to which lymph node, or such contents they may regularly ask. Okay, so apart from these 7 contents which I have listed out, and I want you to add one more important aspect, that is your salivary glands has to be added. Okay, so salivary glands, I mean there are few topics which are ignored in the list of dental decks, but now I'm going to add. So I want you to have a glance over those contents. They're not going to eat your time or brain, but they are very important. Okay, so one such topic is definitely I'll vote and I'll go with salivary glands. And the second topic I want to stress on is the basics of eyeball. Particularly the muscles of eyeball are very common and familiarly asked questions. Maybe that may be covered as that may be covered in the nerve or nerve system. Okay, nerves of head and neck or some areas it will be covered, but the muscles of head and neck it will be covered. But basic anatomy and muscles of eyeball or nerves applied to the muscles of eyeball is very, very important. Then comes, I want you to focus on the basic anatomy of ear also. Okay, so these are the additional things which were not covered in the content list of dental decks, and I want you to add on to your customized preparation schedule. So apart from this, okay, there are few other topics which are listed out, which are topics which has to be done in your physiology rather than in anatomy. Like for example, urinary system, renal system. So what we do, renal system, in understanding the anatomy of the kidney. So we talk about the physiology of the kidney also there in physiology. So it's your wish whether you want to cover the basic anatomy here and jump into the physiology aspect when you're taking physiology, or it's better to make your preparation more comfortable. It's better I'll try to list out all these topics. Topic 8, renal system. Topic 9, respiratory system, means respiratory system where we are going to talk about the anatomy of the lung. How many lobes are present in the left lung, how many lobes are present in the right lung, the basic anatomy, okay, what is nasopharynx, oropharynx, okay, and all these structures from nose, epithelium lining and everything about the lungs, respiratory system. Followed by I'll be talking about the physiology. I'll be talking about your physiology, your volumes, capacitance, everything, how this physiology occurs, how the carbon dioxide is being transformed, how the oxygen and everything. I'll be talking about the physiology. So that my suggestion for you is, I want you to go ahead and try to wrap this in physiology rather than doing here. Similarly, GIT, basic anatomy of GIT. What are the different parts of GIT? What are the different parts of stomach? Similarly, endocrine. What are the different types of glands and their secretions? So secretory part and their action part we'll learn in physiology. So basic names of the glands and what are the hormones they release we learn in endocrine. So so my suggestion, 8, 9, 10, 11, 11, okay, your 13 and 14 will learn in physiology. 12 will learn here. Anatomy of the brain will learn here. That's a dry topic. So anatomy, the basic anatomy of the brain, the basic anatomy of the spinal cord will be doing here. But rest other topics, my suggestion, I want you to include in physiology, because probably we'll try to wrap up physiology immediately after finishing your general anatomy, so that it will be more comfortable for you. So you can take, most of you who are preparing for national boards, try to do anat and physio. Okay, try to do anat followed by physio. So it's going to be more comfortable for you. So next, coming to the few other topics, okay, as already discussed with you, few other topics like blood, it's better you do with physiology, okay. Nerve, physiology of nerve, there is something called as how nerve conduction occurs, how muscle contraction occurs. All these are physiology topics, it's better you do in physiology, okay. So your tissues and body cavities you can try here, but I suggest like blood, nerves and all these has to be done along with the physio. Okay, there are few other topics related to the dentistry were included in anatomy. Okay, so you have some special chapter called as dental anatomy. Okay, which every of these topics will be covered. Okay, right? So I don't mind you do here, or it's better you do there. Okay, so final conclusion of my story is, I want you to take the printout of this. Okay, and take the printout of this, keep this as a checklist, means these are the topics that you have to cover mandatory, okay, and do prepare a checklist similarly for all the subjects, okay. So whether you're done with these topics or not, if you're done, keep a tick mark. If you're not done, okay, keep a different color coding or something, so that along with physio, once physio is done, so most of the physiology and anatomy entire things will be completed, or once your physiology, anatomy and dental anatomy is done, most of the topics will be marked. Okay, so this is how you have to plan, organize your stuff related to the general anatomy. Okay, right? So what to be done, how to be focused, material aspect and everything will be shared respectively on your groups. Okay, right? So I hope this video, how to organize the stuff, is useful for you. Okay, so as of now, signing off, Dr. Shree from Team INBDE CONQUER. If you feel this video is useful, please do hit a like, and if it may be useful for your friends, and do share it. Bye, take care.